Hi, I just want to go over pricing with you at Sundance Implant. My name is Spencer Wabel, and I'm just going to be going through what a single tooth costs all the way up to a whole mouth, and just giving you a brief rundown of how these things are paid for, what the average payment looks like, and hopefully get a better understanding communicated to you of what these things are and how much they can cost. We'll start out with just doing a single tooth. We only do implants here, so we don't do root canals, we don't do anything like fillings and trying to fix those teeth. We would refer you to a general dentist for that. But a single implant looks like that in the jawbone, where you'd have a screw and then an abutment connector piece and a crown. We can do a whole tooth start to finish, and we can also just do the post, make sure that that's packed in and do the surgery part, and then have you go back to your general dentist for an abutment and crown. Usually start to finish, you're looking at about $3 to $4 grand per tooth. And that just depends on which side it's on. Like if it just goes deep, the tooth's already missing, we don't have to extract it, we don't have to pack in any bone, it goes in simple. And you know, if we're doing the abutment and crown, it's usually $1,800 for the post, $600, $700 for an abutment, and $1,000 for a crown. So usually $3,400, but it can be less if your dentist is using different abutments and crowns. We only use Straumann, we won't use any knockoff parts, we only use the best. And usually that's what you're looking at for a single tooth. We don't do veneers here. Those are usually $800 to $2,000 per tooth, and fillings and crowns and things like that can range anywhere from $800 to $1,500 a tooth. Root canals, stuff like that we don't do, but that's generally what you're looking like here is $3,000 to $4,000 for a single tooth. If you're doing a bridge, which is where we take probably a section from here to here, put it on 2 implants, a lot of people end up missing those back teeth so they can't chew anymore, or when they smile real big, like you can kind of see that one's missing. In some cases, I've seen a lot of people who just want some chewing surface back, some people that are saying, hey, when I smile you can see all the way back, I don't like that, you can see I'm missing a tooth. Those are going to range anywhere from $8,000 to $10,000, and that's putting 2 posts in usually, and then abutments and a pontic, which is a little section of teeth there. And after you get those done, you're usually coming out to about $8,000 to $10,000. I just had a patient the other day where she had these teeth, these front ones, but couldn't chew anymore, and so she wanted implants all the way back. We had to do a double sinus lift so that the implants could go in without puncturing the sinus, and hers ended up being 20 grand to do 2 bridges up top right there. And so that gives her chewing surface back. Those can last anywhere from 15 to 25 years depending on how she takes care of it. They're a very nice long-term solution, and it's going to keep her bone in so that there's no bone loss. The reason these are expensive is because they are long-term solutions. They require a specialist, and it takes a long time to master getting an implant in there correctly and then deal with the aftercare. And so you're looking at about $3 to $4 grand for 1 tooth and $8,000 to $10,000 grand, maybe a little more depending on where your bone's at, to do a bridge, up top or down below. It's a little less down below usually because you're not dealing with sinuses up top, but sometimes you have bone loss and nerves to deal with on the bottom, so that's just the general range. The cheapest thing we do here is called, a full mouth restoration. They all are, but it would be a denture on top, and we only ever do a normal denture if we're doing implants on the bottom. Dentures like this set, if it was this and then this plastic thing with no implants on the bottom, you're looking at $6,000 to $8,000 at most places. Some schools and charitable places, because they use less strong materials or inexperienced people, might charge you $2,000 to $4,000 grand, but usually that's what you're looking like for a professional to do it, is $6,000 to $8,000. And in this case, if you're doing a clip-on on the bottom and an upper denture like this, you're looking at about $15,000. And down here, this one snaps on. None of them are goofy looking, but this one is the cheapest option we have to do a full arch without doing dentures. Runs you $12,897 for one, and then $15,897 for the top. So you're looking at about $28,000 to do a full mouth of the snap-in dentures. Now, if you don't go to sleep or use financing, we'll talk about that later. It could be a little less, but that's usually what you're looking at. The next one is called a synthetic polymer. These, you can't really tell in the video because of the materials. I mean, you have to really feel it with your hand, and you'd be feeling it in your mouth. All of them look just like normal teeth, but these ones are going to be stronger than a denture, but not as strong as zirconia. And this one here is going to run you about $18,897 per arch, or $37,000 for a full mouth. These are temporaries. Some people will wear these for years and then upgrade to zirconia. Other times they'll just be in these for 4 months and then they'll move to zirconia afterward. Zirconia feels the most like teeth, and they're heavier, so when we do the surgery, we put the posts in and we put the temporaries, and then these are going to hang off of those posts. When these are put in right away, like some offices will do that, it damages the posts and ends up pushing your case out for months or years if you put in the wrong thing. So we do temporaries, which are a lighter teeth. They don't weigh as much. These are heavier, and they're going to be in there for the rest of your life, ideally. It depends on if you smoke, it depends on if you have diabetes, healing issues, if you have medical conditions that might do that. We have a 5-year warranty on these. If they break, we'll fix them, and an aesthetic guarantee, or if you don't like the way they look, we will go through and fix them to make sure that you like it. A lot of these places are a one-size-fits-all. They're just putting in a block of teeth. They'll say, hey, you can do square or circle or oval teeth, and that's about all you get. We will do a custom fit for your mouth to make sure they look beautiful and they fit your face. We make sure it fits your gum line. We make sure that the smile line fits. Do a total 3D scan of your face. Everything's included to make sure that these fit you correctly. These are going to run about $24,897 per. So you're looking at $49,000 to $50,000. If you end up needing zygomatic implants, which is where we do these big long screws up into the cheek area, instead of just having them right here, they go almost there, and those ones will push the cost up a little more, and that's when your bone has resorbed to clear up there so that you don't have space to put implants. So we do those screws in here, and you won't see them. The recovery is not bad, but they can push the cost up a little bit. So bottom line, to have a full mouth restoration, depends on what you choose, but it's anywhere from $15,000 to $52,000. I would say most people do one arch at a time and then work through financing and try and fix it in parts. Usually what I see is one arch up top or on bottom, depending on which is worse, and then a few implants. So typically I see cases come out to anywhere from $20,000 to $30,000 on average, but there are definitely people that do these, do their whole mouth at once so that they can get back to living as completely as they want to. Other people will just do one arch, and then over time they'll fix it and upgrade it into these different these full mouth options. So they'll go like, hey, I'll do clip-ins for 5 years, and then I'll go to this one, and then after I've got some money, I'll go to that one. Usually your credit score needs to be around 650 to 680. If you have a poor credit score, it only takes about 3 to 6 months to fix it, and I help with that. One guy, it was January, he didn't get approved for anything anywhere and wanted to do his uppers. It was going to be 24 grand. He did credit repair and worked with him for a while. 6 months later, I said, hey, let's just check it again. He didn't know where it was at, and he got financed for the whole thing within 6 months. So there's credit repair, and his was in the gutter because of fraud, because of different credit cards that had gone to collections. It wasn't his fault, and his credit score was the 500s, and we got it up to 650, 680, somewhere in there. It fluctuates a lot when you're repairing it, but we got it up to that, and he was able to finance his full uppers. And we also just had a guy do that where it was January, had to fix a couple things until July, and he's getting his surgery tomorrow. So there's a lot of cases where that happens. Internationally, you're probably looking at 15 to 20 grand. There's a lot of risk going internationally. A lot of people tell me, hey, I'm going to Italy to get these, and it's half price. Well, you might not get the experience. They might not have the education. They might be using knockoff implants. I saw somebody go to Mexico, said, haha, I got it for 16 grand, I beat you. And then I saw her a couple weeks later post, and she ended up, as kind of a warning to other patients, said, hey, I did this, I spent 16 grand in Mexico, they did it wrong, I had an infected mouth for almost a year, and now I'm spending $45,000 to redo it all here. So in some cases, international is cheaper if it works. If it doesn't work, you just pay whatever you paid international, have a horrible experience, and then have to redo it anyway and pay the same money. So in some of these cases, usually you just want to stop at, hey, I put about 45, 50 grand into my mouth, and it worked the rest of my life, great. If you go to some of these really cheap places, that don't have a specialist. A lot of people tell me, hey, I'm going to go to the University of Utah and save a ton of money. That's a student doing it. They don't have the experience. They don't have the parts that we use. They're not going to include the aftercare, and there's a holistic view of these things where you're like, hey, look, I can get it for 20 grand, and then you spend 20 grand fixing it and getting it. And so usually when somebody markets these as a lot cheaper than what I've just said, it is because the doctor isn't using the right parts or isn't as experienced, or they're doing it to, like, they're training somebody, or they don't have as much overhead if they're international. There are some cases where there's somebody really good, like you might have somebody in Dubai that can do a really, really good job. And, do you have the time to fly over there 8 times to get it fixed and done? Do you have time to take off work? Is the opportunity cost worth it? These are things you have to weigh. Usually I see insurance cover 5 to 10% if you have insurance, whether you've been with them a year or 10 years. I usually don't see them cut a check more than probably $1,000 to $3,000 worth, just covering extractions, bone grafting. So typically I don't see insurance cover very much, no matter who you have. When you're looking at dental grants, a lot of people say, I'm going to get a grant, or my buddy got a grant. Usually, to give you an example, if I was to offer a grant at Sundance, right now I'm telling you these cost 48 grand. I could put out an ad that says, hey, you're getting a grant for $10,000. Our usual price is $58,000, but now it's going to be $48,000. So you think you got $10,000 off for a grant, when in reality it was a marketing technique by our office to get you to come in. We don't do that because we think we should just go, here's the price, this is what it is. There's not gimmicks or anything. There might be a discount if you pay all cash, which, like, if you went and got a loan at a bank and then came and gave us the check, we don't have to pay any financing fees or credit card processing transaction fees, so you can save some money that way if you're paying it all cash or paying it from a different institution. Or sometimes people don't go to sleep because they have had extensive dental work done, or they just had dentures, and so we're just going to do 4 implants. People get 4 implants awake all the time, and when I say awake, I mean you're not going to feel it. Like, there's nothing we do here where you don't feel it, or where it's going to be numb every single time. There's no situation where, to save a couple bucks, you have to feel the surgery. There's never a case like that. You'll be numb every single time. It's just whether or not you want to be conscious for the 3 to 5 hours it takes the surgery to go, but you're not going to feel, any of the operation going on. Usually people will stage it where they might say, I'm going to go the cheaper option right now and then upgrade it later on, but it really just depends on your preference. I hope this helps kind of understand, what insurance pays for, what international pays for, what these things cost, and generally what it is nationwide. And I hope that I can help you fix whatever you need to fix to get this done, because they are life-changing and it really helps a lot of people. Anyway, hope to talk to you soon, and I hope you have a great day. Bye.